Wonderful. Welcome everybody to today's presentation on preparing for joint replacement. For those of you who don't know me, my name is Kristen Wilson. I'm one of the owners of Action Potential Physical Therapy. We have a location in Glen Mills, and we also have a location in Kennett Square. You might be wondering, why is my hair like Princess Leia today? Well, it's because it's May the 4th, which is a national day to celebrate Star Wars. So in our offices today, our whole crew is dressed like Star Wars characters, and we're having a really fun day celebrating, one of the best movie series of all time. So hope you don't find that too unprofessional, but even Princess Leia has to learn about joint replacements. So we'll go with it. Today, we're going to be talking about how we can get ready for joint replacement and really what that means for both the body as well as the mind, since it can be kind of a daunting task and a daunting undertaking. And my job today is to help alleviate some of those fears so that you have a better understanding of what to expect, as well as the available support for you as you go through that process. So today in the presentation, we'll first talk about arthritis and describe what arthritis is. It's important to have a good understanding of why something like a joint replacement would be necessary. We'll talk about the benefits of having a joint replacement, as well as some decision factors to help determine, is a joint replacement right for me? And then we'll talk about how to prepare as well as how to recover when having a joint replacement done, including the different courses of physical therapy that you can expect through that recovery process. Certainly, I'll open things up for questions at the end, as well as if you stay tuned to the end, I'm going to share with you my top tips for healthy aging, which are some really nice exercises that almost everyone should incorporate into their daily practice in order to keep their bodies healthy and fit. So let's first start by talking about arthritis, because there is some misunderstanding about what arthritis is. I love the photos here on the screen because these really identify and exemplify what arthritis looks like in the joint. So in this picture here, you're looking at a healthy knee joint on the left, and you're looking at a knee joint with arthritis on the right. And what you see is that arthritis is a breakdown of the joint surface. It causes the joint to wear away and cause other issues like pain, swelling, stiffness, and then as a result, a limitation in your ability to do things. So most people in the United States report having arthritis in one or many joints. So know that this is a very, very common a disease that many people have. And it really comes from the fact that our bodies are living much longer these days. And so those joints start to have some natural wear and tear on them, much like a car that's older would have wear and tear on the engine. We see in the human body this breakdown of the cartilage and the bones because of wear and tear. It is a very normal process. And certainly, as we talk about some things today with regards to joint replacement, it is something that can be managed very conservatively to a point. So when we talk about arthritis, it's important to identify that there are risk factors that put you at a higher risk for having arthritis. So some of those risk factors are able to be modified. We call those modifiable risk factors. And some are called non-modifiable, meaning there's a good chance that you have little control over those risk factors. So for the non-modifiable ones, or ones that we really can't control, that would include genetics. So if you have a history of having arthritis in your family, there's a good chance that you yourself could have arthritis throughout your life. Women are more likely to have arthritic joints than men. This has to do with the protective role of estrogen on the joints. And as women go through menopause, they lose that protection of estrogen, and we start to see advanced joint breakdown. We also know that age is non-modifiable. As much as we might all want to stop aging, it just keeps happening year after year. And as we get older, the risk for arthritis increases. And again, it's that wear and tear phenomenon. We're putting a lot of work through our joints. And sometimes as we age, they're not able to handle all of that work. Modifiable, these are the risk factors that we can take an active role to help to control. The first is joint injury or joint infection. This is where your friendly physical therapist can come in to help teach you about how to use your joints in the safest way possible. There are certain activities that put us at risk for wearing down our joints more quickly. And what we do as PTs is we look at how you move and we make some recommendations to help prevent that joint injury from continuing. Obesity. You can imagine if you are a heavier individual, that means that you're putting more and more weight through your joints. And we want to make sure that we keep that weight off of the joints so that those joints don't break down even further. So having a good plan to help manage your weight through diet and exercise is an excellent way to help preserve and retain your joint function. Occupations involving joint stressors. For any of you that have ever had carpet laid in your house, you've seen those guys come in and they put those knee pads on their knee and they use their knee to ram the carpet underneath the baseboard over and over and over again. You can imagine if that was your job day in and day out, banging through your knees, that's going to put a lot of stress through the joint. Heavy laborers like carpenters, masons, they tend to have a lot of joint arthritis because of that stress and wear and tear. And then lastly, poor biomechanics. And this is just really a fancy way of saying that your body isn't moving as optimally as it should be. So our bodies start to pick up on bad habits as we get older and our activity levels change. And we start to use these bad habits at the risk of causing some injury to our joints. So again, a physical therapist can come in and watch your body move while you go up and down the steps or get up and down from a chair and make suggestions on how to optimize how your joints are lined up. What we see as a result of arthritis is what we in the physical therapy world call activity limitations. And these are any problems with things in your daily life that either cause pain or cause increase in exertion, meaning they take a lot more energy to do. The most common that I see in regards to arthritis is difficulty with walking. People will report that it's hard for them to walk farther or up and down varied terrain because of the pain in their joints. We also see an inability to perform household tasks. So maybe it's getting down and gardening on your knees or reaching under the bed to get some socks that fell underneath. Maybe it's lifting up a laundry basket or going up and down the stairs. So those things that we typically take for granted as part of our daily household life become increasingly more difficult. Painful leisure activities. So for anyone out there who plays pickleball or golf or likes to walk the dog or play with their grandkids in the backyard, sometimes arthritis can interfere with your ability to do those leisure activities. And as a result, we tend to pull away from them and stop participating, even though they bring us inherent joy. Trouble with morning tasks. So arthritis is typically worse in the morning. And this is because our body has been still all night and it's very stiff. So when we wake up in the morning, it almost feels like we're the Tin Man. We need to oil all the joints, get everything moving correctly so that we can go about our daily tasks. And what we notice is that throughout the day, as we get moving, that arthritis starts to release and we're able to move with greater ease. And then lastly, unable to pick up grandchildren or children. So this is one that I hear very frequently from patients of mine that have grandchildren is they say, oh, my knees kill me. I'm taking care of my grandson and I can't pick him up without my knees or my hips hurting. So these are certainly very important things in life that we want to make sure you're able to do without pain and without any problems or causing further problems. So how do we control that pain? Certainly, you can talk with your doctor about controlling that pain through medication, and whether that's over-the-counter medication like Advil, Tylenol, or Aleve, or something a little bit stronger. But we want to be really mindful that with medications come side effects, and we have to be really cautious about how those medications interact with either other medications that we have or some of our daily functions like bowel and bladder or thinking clearly, because all of these medications have to be accounted for and could potentially affect our ability to do other things. Certainly, ice and heat are a nice way to control the pain. People always ask me which one's better. There's really no answer to that. If you have arthritic pain, it's really up to what feels best to you. So ice is not better than heat. Heat is not better than ice. It's really what your body prefers. When we use heat or ice, we're really just trying to trick the brain into forgetting about that pain so that we can do other things without focusing on it. Compression, that essentially means squeezing around the joint. And we can do that with something like an ACE wrap, which are those long elastic bands that you can buy at the drugstore. Or you can use something like a neoprene brace, which is almost like a sleeve made out of very stretchy material that you can slip over the joint that's painful, whether that's your knee or your elbow, wrist, and it gives a squeezing support to the joint. Again, these aren't going to change the structural nature of your joint, but it helps to trick your brain into forgetting about that pain. Elevation. If your joint is really swollen because of arthritis, you can elevate that to help manage some of those fluids. This is particularly helpful if you have arthritis in your feet or in your knees. Keeping it elevated is going to allow that fluid to come out of that joint so that it doesn't cause additional pressure. But the most important thing, and I can't emphasize this enough because many people think this is counterintuitive to arthritis, but the most important thing that you can do to help your arthritic pain is to keep moving. When we move that joint, what it does is it brings blood flow and nutrients to the joint to help eliminate waste products and inflammatory cells. When we sit very still, those waste products build up and they actually cause more pain. This is why we're so stiff in the morning. But if we move and we allow that joint to feel the blood flow and to be lavaged of all of those waste products, the pain starts to subside and the joint can actually heal in some ways. So, what are the pros and cons of having a joint replacement? And whether this is an ankle, a knee, a hip, a shoulder, a wrist, whatever the case may be, we have to look at the pros and cons because certainly in order to make an educated decision for what's best, we want to see what are the things that are going to get better and what are the potential risk factors. So in terms of pros, certainly the number one pro of having a joint replacement is that you'll be free from pain. Now, certainly we have to keep in mind there's going to be the post-surgical pain that we'll have to navigate together. But long-standing, many people report that after having their replacement, it's a different kind of pain. It's not that deep, aching, throbbing pain. It's a surgical pain, and that pain starts to release and reduce as we rehabilitate from the surgery. People report improved stability, meaning that they feel like their joint is more stable. It's not giving out, it's not creaking as much. It doesn't feel like it's always going to give way. Improved flexibility, we call that in the physical therapy world range of motion. And also we see improved mobility, the ability to get around better walking, better stairs, better getting up and down from a chair, better being able to pick things up without pain. So we see that not only is the flexibility of the joint enhanced, but your ability to get around and use that joint is much better. And then lastly, overall improved quality of life. You're able to participate in those things you love, like pickleball or golf or picking up your grandkids or getting on the floor to play with them. It's that overall sense of satisfaction that your body is performing the way that it's meant to perform. Certainly, there are some risk factors that we need to consider, like delayed wound healing. With the right kind of team, this is usually a moot point because together we'll monitor that joint to make sure that it is healing appropriately. Infection is the number one reason for any kind of complication after a joint replacement. But again, we'll be monitoring that as your medical team to make sure that there aren't any signs or symptoms of infection in your joint. A leg length discrepancy. And what that means is that after having a knee or hip replacement or ankle replacement, oftentimes one leg is incrementally longer than the other. You have to imagine we took out all of that bone that was decayed and we put in a little piece of metal, and that might end up making one leg slightly longer. But this is something that, again, we would manage and make sure that it's not problematic. Restricted flexibility. And again, this is typically only immediately after surgery. And then we see that with rehabilitation, that flexibility is restored to normal. A loose implant. This is very rare and we don't see this very often, but sometimes your prosthetic knee or hip can become very loose within the socket. And that might mean having a multiple surgery or having an additional surgery to make sure that it can be re-adhered. Again, please hear me when I say this is a very rare scenario, and often is not an issue for people in recovery from a joint replacement. So the biggest question I get is, when do I know, Kristen? When do I know it's time to get that joint replacement? And while I can certainly provide some context here, please know that this is a very personal decision. It's based on your level of pain, your family support system, timing, your health status. There's so many different things that factor into making that decision to move forward with the joint replacement. But the key things that I often share with people is that you'll know because the pain will be unbearable. It'll be so that it is interfering with everything that you want to do. I remember before my mom's knee replacement, we were at the school watching my kids in a Christmas concert, and we walked out the door and she stepped off of the curb and winced out loud in pain because her knee was so painful. And at that point, I turned to her and said, "I think it's time." And she said, "I think you're right." Because the pain was just interfering with too much. As a young active woman, or even as an older active person, when that pain is limiting you and is so unbearable that you can't do the things you love, it's time. If you're noticing some instability or buckling or the sensation that the leg is giving way, that's usually a good indication that it's time to look into providing some stability to the joint. If your activities are severely restricted and you're finding that it's limiting your quality of life and possibly even leading to social isolation, you can't get out and play with your golf group, or you're not playing pickleball anymore, or maybe you can't even get out to go see your grandkids play their sporting events because it hurts too badly. These are some indications that it's probably time. But certainly the most clear indicator is to talk to your surgeon and talk to your physical therapist to talk through each of these things to determine, is it time? Because certainly the benefits of taking care of that issue before it's too late are very, very high. So if you've made that decision that, yes, I'm going to move forward and I'm going to do a joint replacement, you're certainly going to be consulting with your surgeon to figure out when that's going to happen and where that's going to occur, whether it's a surgery center or some type of a hospital setting. You can work through that with your practitioner. Before that surgery, it's going to be important that you keep your physical function as best as possible, meaning keeping your heart pumping healthily and your lungs active by doing some light aerobic strengthening exercises. Maybe that's going for a walk or riding a bike or swimming in the pool to help get your lungs and heart ready for that surgery. Certainly, we can do some muscle strengthening exercises to help build the muscle around that arthritic joint so that after the surgery, those muscles are able to step in and perform correctly. Maybe it's doing some balance exercises to make sure that you'll feel safe with that new knee and not at risk for falling. And then lastly, maybe it's preparing the body to accept that new knee by doing some stretching exercises. The easiest way to feel comfortable with all of these things is to consider a physical therapy consultation before going in for surgery. So what does that look like if you do decide to do a physical therapy consultation? So first thing to keep in mind is if you're already planning to have a joint replacement and you decide to do PT, it's probably only going to be a few sessions, because what we're going to do is just get your body ready for that surgery and then pass things off to the surgeon to do the joint replacement. Before that surgery, we will teach you how to safely exercise to help minimize the wear and tear on your joints, as well as teach you optimal joint mechanics or techniques that will help you be more successful after the surgery. But most importantly, what we will do is help walk you through what that surgical process is going to be like. Like I talked about in the beginning, this is a very, very big decision, and it weighs not only physically, but psychologically and emotionally on people as they prepare. And your physical therapist can help you, give you the tools so that you can go into that surgery feeling very comfortable and successful, so that your anxiety and fear doesn't overcome your ability to rehabilitate. So, in those sessions, we'll teach you about some exercises that you can do after the surgery so that once you're out of that anesthesia, you can start moving your body safely. We'll teach you how to manage the swelling and how to manage the pain. And we'll teach you about what things to look out for to make sure that your surgical site is healing correctly. We'll also go over things like how to use a walker and how to get up and down the steps after your surgery. Years ago, this used to all be done after a joint replacement because people would stay in the hospital for several days. Well, what we're seeing now is that usually after a joint replacement, it's only a one-night stay overnight, and then you're sent home. So we can teach you ahead of time how to practice so that when you do come home, you're feeling very successful and safe. And then lastly, we'll help you prepare mentally and psychologically so that your body is not anxious about that surgery. We'll talk you through all of the steps. We'll teach you about what to expect, and we'll alleviate any of those fears by answering your questions. So let's say you've made the decision. You're going to get the surgery. You get the surgery. What can I expect afterwards? Well, certainly it goes without saying that you've had a major surgery done, so there is going to be some pain. And that's not to be afraid of. The pain is going to feel different than your pain before, and we're going to give you the strategies to manage that pain so that while you have it, the pain, it's not paralyzing. It's going to be very manageable, and we'll teach you those techniques. You're certainly going to have stiffness and swelling. And what many people don't realize is that stiffness and swelling can last upwards of 6 months after the surgery, not weeks, but months. And that's very normal. We've introduced a new thing into the body, and that body has to adapt to that over time. So it's not uncommon for your joint to feel stiff or swollen for a very long time after that surgery. But again, we'll teach you the strategies for managing that. You're certainly going to not be able to get around as well as you did before the surgery, but that's because of the surgery. It's not because anything is wrong with the joint anymore. But we'll teach you how to get around safely so that you're able to get up and down the steps, get on and off the toilet, and get in and out of the car without problems. And that may or may not involve using something like a walker or a cane, which is what we call an assistive device. But we'll show you how to use those devices to help advance your mobility or your walking, not take away or hold you back. We'll definitely talk about strategies of what you can do to accept help from family and friends. Depending on your personality, some people love asking for help, some people hate asking for help. But we'll talk about what are the things that are going to be very helpful for you in terms of getting through that post-surgical rehab. And the last thing that I tell people is after surgery, it's your job to exercise. It's your job to get up and move around. So while maybe the laundry feels like it should be your job, or making dinner for your spouse feels like it should be your job, that's not your job after surgery. Your job after surgery is to take care of yourself and exercise and move. And we'll teach you all of those strategies. Therapy models, it's important to recognize that there's many different ways that physical therapy comes into play with regards to a joint replacement. Certainly, when you have your joint replaced, whether it's in the hospital or a surgical center, you will have 1 or 2 encounters with a physical therapist to just make sure that you're able to get up and get into the car, get on and off the toilet, and do some of the more basic things. This tends to be a very quick visit and often occurs very short after the surgery. So what I've heard from my patients is that sometimes it's really overwhelming because you're still trying to get through anesthesia and the pain is still having difficulty being controlled. So while you're getting that information, sometimes it can feel a little bit on the overwhelming side, which is why I really strongly advocate for doing that before the surgery when you are clear of mind and you are able to problem solve. Many surgeons these days are not recommending therapy after a joint replacement. There's many reasons for this. There is some research, and I'm very strongly saying some research, that indicates that in healthy younger people that have a joint replacement, they recover just as well with and without therapy. However, what we have found is that many of the surgeons have latched on to that research and promote that. However, don't take into consideration that the majority of their patients are older and maybe have other health issues or some type of anxiety issues in regards to managing that post-surgical care. The other thing to keep in mind is that sometimes surgeons have a financial interest in not promoting physical therapy because that allows them to recover more of the rehab-related costs. So there's a lot of different factors that we need to consider. One of the models that has come out of this idea of not recommending therapy is computer-based exercise. And what that means is that after having a joint replacement, your surgeon may send you home and say, oh, you'll be fine. Just do these exercises that the computer is going to tell you to do. I don't know about you, but if I had my leg just surgically managed and I came home and the only support that I had was a computer monitor, I wouldn't feel that comfortable with that because I'd have questions that I'd want to ask. I'd want feedback for how I was doing. I'd want help to perform it successfully. But this is one of the strategies that some surgeons these days are using. Another strategy might be going home with a therapist that comes to your home. Some surgeons are doing this, but many have stepped away from this in favor more of the computer-based exercise program. If you are fortunate enough to have a therapist come to your home, they will help you with things like getting around the house, getting up and down the stairs, as well as taking you through some exercises. And this can be a very helpful model. Rehab, this would be leaving the surgical site and going to an inpatient hospital where you stay overnight to do rehabilitation. This is very, very rare these days after a joint replacement. This used to be the mainstay. However, now in an effort to reduce costs, there are very few insurance payers that are covering inpatient rehab for a joint replacement, especially if it's only one joint that's replaced. So certainly it is an option, especially if you are someone who has a complex medical history. However, we aren't seeing this very frequently in our rehab care. The last one is going home with outpatient physical therapy, which means you go home and then you go someplace to do your PT, like Action Potential or another physical therapy site. This is probably the most common way that I see post-surgical management taken care of. And it is a very successful option. It's a way to have someone guide you through that process with hands-on care and the ability to answer your questions and progress you at your own pace. This is a really nice way for you to feel comfortable through that rehab process so that your questions are answered and your needs are met. Certainly when we talk about physical therapy after the surgery, there's going to be a lot of key things we're going to focus on. Monitoring your wound, making sure there's no signs of infection. We're going to teach you and help you manage your pain and quickly try to maneuver you away from using opioids for pain management, since we know how dangerous those can be, both from a side effect perspective as well as from an addiction perspective. We're going to encourage you to move in ways that you feel comfortable so that you can safely return to the flexibility and strength that you need to be able to do your daily tasks like walking, going up and down the stairs, getting in and out of the car, etc. We're going to help to restore your balance because certainly now that there's a new joint, we've got to teach that joint how to work within your body so that you're stable and feeling safe and not at risk for falling. We're going to teach you how to exercise properly so that you never have to go through this process again. Certainly, we don't want to have a joint replacement have to be replaced with another joint replacement because of still wrong technique. So we'll teach you how to exercise the correct way. And most importantly, will help you get back to the things that are important to you, your specific activities that are meaningful, whether that's getting down on the floor to plant flowers or play with your grandkids, or maybe it's to bend over and pick up a golf ball. Whatever it is, we'll work with you to find your goals and help you be able to return to the tasks that are most important to you. So with that, I'd like to open it up for questions. Certainly, if there are questions that you have that come later, please feel free to email me. This is my personal email address, and I can help to provide any type of information for you, including, hey, who's the best surgeon for a knee replacement? Or where should I go to get my hip looked at? I can help answer those questions for you so you feel that you're partnered with a good orthopedic surgeon. I also promised a free download, which is here. It's reachyours.com/healthy aging. And it is healthy aging with a Y. It looks like there's a little typo there. When you go to that website, Healthy Aging, you're going to see an ability to download my top 5 exercises for keeping your body limber and strong. So please feel free to take advantage of that as well, so that you're able to help restore your strength.